Good afternoon, everyone. You are very welcome to the Integrating Cancer Prevention and Early Diagnosis into Health Promotion webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature, which is located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Now, without further ado, I will hand you over to your host for today, Lisa O'Donnell, Senior Health Promotion Officer for Cancer Prevention. Thank you.
Thank you, Jean, and welcome everybody to our webinar today. And the topics covered today will be around tobacco training, health inequalities, staff health and wellbeing, and stakeholder engagement. So first up, we're going to have my colleague, Bernie Mullins, who is the Senior Health Promotion Officer for Cancer Prevention in HSE Midwest. Bernie is going to give a brief overview of cancer prevention and early diagnosis and provide the rationale as to why we need to have a cancer prevention focused programme in Ireland. Thank you, Bernie.
Good afternoon, everyone. So I'm going to give a very brief context to current cancer statistics in Ireland and provide some of the rationale why we need a cancer prevention focused programme. So I always think this is a good place to start, just to define cancer for anyone who may not understand. It's a condition where cells in a part of your body grow and reproduce without control. These cancerous cells can invade and destroy surrounding healthy tissue, including organs. And sometimes it begins in one part of the body, it can spread to other areas, and that's known as metastases. So in Ireland, the 5 most common types of cancer are prostate in men, breast cancer in women. We have breast cancer in males, but it accounts for about 1% of cases. So when we refer to it, it's for women here. Bowel cancer, lung cancer, and skin cancer across both sexes. So this is a maybe more visual representation of this. You can see male data is on the left in blue, female in the peach color on the right. So again, really common, the prostate, colorectal, breast, lung and melanoma skin. But if you look down to the bottom of the screen, you can see the highest cause of cancer-related death is actually lung in both men and women at 21 and 19% respectively. So these 5 cancers, we focus them, they nearly account for almost 60% of invasive cancers in Ireland. So we focus our efforts there to make the maximum impact. So looking at the future in Ireland, don't want people to get bogged down in the data, but it's like the steps of a stairs. You can clearly see that it's trending upwards, and we cannot continue to treat our way out of the cancer problem. Treatments are improving every day, but our health service won't have capacity, and that's a lot of human cost as well behind those numbers. So it's anticipated there will be exponential rises in cancer cases in Ireland. So why would you focus on cancer? Again, huge numbers and anticipate a rise, but every year about 43,500 people in Ireland develop cancer, and it's now the #1 cause of death in Ireland, accounting for 3 out of every 10 deaths annually. So we're here today for cancer prevention. The World Health Organization would estimate that between 30 to 50% of all cancers are potentially preventable through changes to modifiable lifestyle or behavioural and environmental factors. So going back to the Irish context, a study was done in 2016 by the National Cancer Registry in Ireland. It looked at 11 modifiable specific risk factors that are potentially preventable. Now, we'll share the reference for this afterwards. There's no need to strain your eyes, but very top of the table will be smoking, overweight and obesity and infection. So what are those factors? Time doesn't allow us today to go into these in any great detail, but just to say there is a myriad of resources on www.healthpromotion.ie. There's easy read leaflets, the NALA approved, to increase that awareness that there are things we can all do to reduce our risk of cancer, such as smoking, being physically active, alcohol, vaccines like Hep B and HPV vaccine, and breastfeeding. So really worthwhile, and we'll be signposting to those afterwards. So when we look at the stage of the cancer, stage 1 would really be when a tumour is small and not grown outside of the organ it started in, all the way down to stage 4, where it actually can spread through the blood or lymphatic system to a distant site in the body. We want to get the earliest diagnosis of cancer as possible at that stage 1 or stage 3, as opposed to stage 3 and 4. The reasons being is if we diagnose cancer early at stage 1 or 2, it's a key step towards higher survival rates, a reduction in the treatment severity that person has to undergo, improving the quality of life of patients. And again, you know, when the HSE capacity, looking at a lower cost of cancer care as well. So the earlier, the better diagnosis for cancer. This slide kind of reflects what I've just said in a visual way as well. I think a picture speaks 1,000 words. If you look at the green bars here, they reflect, those 5 common cancer types where you have diagnosis stage 1 as opposed to stage 4, which is in the red. So I think it kind of speaks for itself. You can see really good survival rates at stage 1 for melanoma skin cancer, prostate, colon, breast. Unfortunately, you can see lung at the right of the screen. It's really about 50% for stage 1 and 4% for stage 4. And just to say that the majority of cases of cancer in Ireland would be diagnosed through symptomatic services, over 85%. So we work with the National Cancer Control Programme, and in terms of our strategic direction, the 3 main plans or strategies that inform our work. And again, we'll be sharing the links to all these: the National Cancer Strategy, National Skin Cancer Prevention Plan, and the Early Diagnosis Symptomatic Cancer Plan. And just to say as well, the NCCP would conduct a lot of research into attitudes and awareness among the public in relation to cancer, such as these. We can share those links too. And they have one that will be published soon, hopefully, in relation to cancer awareness and attitudes among the traveller community in Ireland. So we're really looking forward to that being released so we can use it again to inform our work and support this community. Just to reflect, I'm conscious a lot of healthcare professionals on here today. People can hold negative beliefs about cancer, especially if they're, that 50+ age bracket, and if they're socioeconomically deprived. This matters because people are less likely to seek help from a doctor first if they have possible cancer symptoms. So really, we need to have that at the back of our minds. Just to flag as well, we have 3 free HC cancer screening programs. They're run by the National Screening Service. So bowel screen, breast check, and cervical. So again, we need to be encouraging uptake of these programs in people as much as possible. Bowel screen and cervical are actually preventative, not just looking for cancer before there's symptoms. So we can signpost to that site as well afterwards. And just to say, generally speaking, we have about 72% uptake for cervical screening, 74% for breast. So, there's room for improvement there. But just to say, we have just under 50% for colorectal cancer. So just there is any healthcare professionals always be thinking signposting people to bowel screen in that age group of 59 to 69 years. It's a really non-invasive initial test. It's done in the comfort of their own bathroom. It's a quick swab of their stool. So it's one we really want to get the uptake of. So I'm going to finish there. That was just the tip of the iceberg, just to set the scene for today. So I hope you found that interesting, and I'll hand you back now. Thank you very much.
Thank you, Bernie. Really good presentation highlighting the need for cancer prevention focused programme in Ireland. Next up, you're going to hear from my colleague, Anne-Marie Lawler. Anne-Marie is the Senior Health Officer for Cancer Prevention in HSC Dublin and South East, and followed by myself. So Anne-Marie will give a run through of an integrated care pilot project, and I will take you through an early diagnosis of lung cancer awareness campaign in North Dublin. Thank you.
I'm going to talk to you today about an integrated care pilot project under the heading of tobacco. The project is called Empowering Cancer Care, Optimising Stop Smoking Brief Interventions Throughout Cancer Treatment. This is a project between the Regional Cancer Services in the South East and HSC Health Promotion South East Community Stop Smoking Services in the South East. So just to give a context to this project, when applying health promotion to all levels of cancer prevention, as health promoters, we are very familiar with our primary prevention for a whole population. You'll see that we have the Making Every Contact Count logo to the right-hand side, where we look at, modifiable lifestyle risk factors. We also have the NCCP, Reduce Your Risk, and all of the cancer-specific lifestyle risk factors that we target messages and our activities at general population and also at those at risk. Secondary prevention includes people at risk of health problems. We have screening, National Cancer Screening Service, which is bowel, breast, cervical cancer for the general population or whole of population. But a big part of our cancer prevention health promotion work is around early diagnosis. So knowing the signs, finding cancer early, huge part of how we promote our secondary prevention activities. Now, this project I'm going to talk to you today about is very much sitting in the tertiary prevention area. It's targeted at people who have disease, so people already attending cancer services and have been diagnosed with cancer. So just to have some background, recent research published by UCD in the last 2 years has shown there is a disproportionate rate of smoking cessation amongst cancer survivors when compared to the general population. Research shows that cancer patients are less likely to be offered brief interventions for smoking cessation or referred to smoking cessation services while attending cancer treatment, as they would be if they were in other parts of the hospital receiving services. Staff barriers to interventions around stop smoking have been identified in research. Within this research, cancer patients themselves identified that they want healthcare professionals to ask and discuss smoking cessation, with particular emphasis on short-term benefits. Research also shows both immediate and longer-term benefits of stopping smoking for cancer patients, from diagnosis right through treatment to surviving or living with cancer. So some of the staff barriers to delivering stop smoking interventions. Well, smoking amongst cancer patients leads to poor outcomes, yet many patients continue to smoke. Research identifies both patient and staff barriers to stop smoking after cancer diagnosis. So addressing any identified staff barriers would be an important step to addressing inequalities for cancer patients' access to stop smoking support. So the identified staff barriers were stigmatizing patients. Staff didn't want to feel they were stigmatizing their patients in any way, especially with a cancer diagnosis. Inadequate training in smoking cessation, perceptions that such discussions are not appropriate, likely to be ineffective, and referral pathways. So this project is about research to practice, and the focus is on the staff barriers. So the aim of the project is using a knowledge transition framework and national clinical guidelines to underpin the importance of these stop smoking brief interventions. This project will assist staff that want the best outcomes for their patients to integrate a care pathway to the already established community services that can provide specialist stop smoking support. So the objectives of this project is taking research to practice with a focus on staff barriers. So objectives are to provide cancer patients who smoke with equal access to stop smoking supports with the right care in the right place at the right time, to empower staff to optimise brief interventions for stop smoking with their patients throughout all stages of cancer treatment, diagnosis, treatment, right through to survivorship, to provide easy access and direct referral for the acute pilot site to the community stop smoking services, and to establish and integrate a collaborative professional relationship between the acute cancer services and community stop smoking services here in the Southeast. So looking at other staff barriers, the perceptions that such discussions are just not appropriate, well, staff are not always aware of the National Clinical Guideline number 28, which is around stop smoking, which says that all healthcare professionals should ask and document individual smoking behaviour, but also says that professionals should advise all people who currently smoke about the harms of smoking to themselves and others and the potential benefits of stop smoking. Looking at benefits of stopping smoking for cancer patients. Benefits include better treatment outcomes, fewer treatment-related complications and toxicities. So that means lower risk of infections, fatigue, lower risk of heart and lung problems from treatment. Faster recovery from treatment, and this is especially true after surgery. Reduced risk of reoccurrence of the cancer. Fewer new second primary cancers. Better survival rates. And lung cancer mortality is lower with decreased smoking. And smoking-related complications have been shown to decrease by up to 19% per week after stopping. So how this project will work? The project is underpinned by research, clinical governance, and a quality improvement structure. Steering group established, staff engagement, a tailored education intervention be designed, pilot site champions to sustain the momentum of the project, new direct electronic referrals to local stop smoking services, and a review with recommendations and the potential to replicate this project towards the end of 2025. So that's where this project is at. It's a very exciting project, and thank you for the opportunity to share this with you.
Good afternoon. My name is Lisa O'Donnell and I'm a Senior Health Promotion Officer for Cancer Prevention in North Dublin. Today I'm going to present on a recent early diagnosis of lung cancer public awareness campaign that was piloted in North Dublin. This campaign was a collaborative piece of work between community healthcare organisation Dublin North City and County, the National Cancer Control Programme, and HSE National Programmes and Campaigns Department. So why did we decide to concentrate on lung cancer? Because lung cancer is the third most common cancer in Ireland, but the commonest cause of cancer death. Most cases are diagnosed late, but treatment options and survival rates are better than ever, especially when lung cancer is found early. A recent national survey on lung cancer awareness reported that unprompted knowledge of lung cancer is poor amongst the Irish population. It highlighted that less than half of people surveyed did not know that persistent cough or a cough that won't go away could be a lung cancer symptom. So why did we target North Dublin? Epidemiology showed us that the rate of lung cancer in North Dublin is higher compared to other areas. North Dublin also has significant areas of deprivation and the older population compared to the rest of the country. We also felt there was service readiness in North Dublin as there had been a cancer prevention officer in the area since 2022. It also had 2 rapid access clinics which are located in the Mater Hospital and Beaumont Hospital. So let's look a little bit more at the campaign itself. It was a 6-week campaign that ran from the 29th of July to the 15th of August 2024. Key messages were persistent cough that lasts longer than 3 weeks could be a sign of lung cancer. The second message was for people to contact their GP or doctor without delay if they develop a cough that does not go away after 3 weeks. This was also the call to action. These messages were informed by the results of the pre-campaign lung cancer awareness survey. It was a public-facing campaign which targeted the population at high risk of getting lung cancer, such as smokers and ex-smokers aged 50 and over living in socio-economically deprived areas. We took a multi-pronged approach to promote the campaign, which included social media, print media, and other methods. The campaign messages were displayed on out-of-home ads such as bus shelters, on some pharmacy screens, through press ads, on social media, and through community promotion. Our partner pack went out to over 820 relevant stakeholders across North Dublin. Our research and evaluation plan was drawn up and included pre- and post-campaign surveys. 150 people in North Dublin and 150 people in a control group were surveyed. The control group was in Tallaght, South Dublin. The patient focus group was used to inform the design of the social media creatives and out-of-home posters and leaflets. Pre-evaluation is underway to assess the performance of the pilot campaign and the impact in North Dublin, and this will include evaluation of the social media and other ads. Here we can see the social media creators agreed upon, 2 images and 1 short video. They included the key messages I mentioned earlier and signposting to the Check That Cough website, which gave them further information about the signs and symptoms of lung cancer. The final report for the campaign has not been published, but I am going to highlight some of the initial findings from pre versus post surveys. Here we can see pre-campaign, 56% of people are worried about lung cancer, and this dropped to 42% post-campaign. We are not sure if this is a good or bad, but we do say that if it is picked up earlier, your chances of survival are better. So I like to think it's a good thing, but we don't know for sure yet. This shows the prompted symptom recognition data. Hemoptysis or coughing up blood was top of the chart and one of the most recognized symptoms. As you can see, there was an increase in recognition of all symptoms of lung cancer, and I have just highlighted the 3-week cough there as it was the key symptom in the campaign, and it shows a 14% increase of awareness of this symptom. So how soon would you seek medical advice? As you can see, it went down for hemoptysis or coughing up blood and changed to usual cough. But if you have shortness of breath or a 3-week cough, somewhat more people are likely to seek medical advice. The barriers to contacting a doctor. We know that pre-campaign, the commonest barrier was, I would think it was a cold or cough. That was 63% pre-campaign and fell to 36% post-campaign. As you can see, the percentage of all barriers dropped post-campaign, which can only be a good thing. What impact did the advert have? As a result of seeing the ad, 84% of participants would be more likely to advise someone with a cough for 3 weeks or more to visit or contact a GP. 83% agreed that if they had a cough for 3 weeks or more, they would be more likely to visit or contact their GP. And 7% of people who recalled the campaign contacted the GP after seeing the ad. It was good to see that people would take action themselves or encourage others if they had a cough or go to see the GP. As mentioned earlier, the final report has not been published yet. The next steps will be agreed based upon the findings in this report. Thank you. Well, thanks everyone for listening. I really can't wait to get the final report of the lung cancer campaign. I was delighted to be involved in it. I'm happy to see that it did raise some awareness. Thank you, Anne-Marie, for your presentation. It was a great example, collaborative, working to promote the benefits of smoking cessation for cancer patients. So next up, Shirley O'Shea, Senior Health Promotion Officer for Cancer Prevention in Community Healthcare West, is now going to talk about the potential of integrating cancer prevention and early diagnosis into existing health promotion training.
Hello, everyone. I'm going to talk a little bit about training and how we can review the potential for integrating cancer prevention and early diagnosis into existing health promotion training. So we have a wide range of national training that's currently delivered locally by health promotion teams. So this is a great opportunity for us to start thinking about how we can incorporate some of the cancer prevention and early diagnosis messages into the training programs that are already being delivered widely. We also have started talking and working with our colleagues in Make Every Contact Count, and that's ideally placed in terms of cancer prevention. And there's overlap in the health behaviours and the importance of encouraging health and social care professionals to have the conversation about health behaviour change. So we also have the opportunity to promote the Making Healthier Choices, which is the SPHE program at post-primary level, which also covers some of the SunSmart lessons as part of junior cycle for post-primary schools. So it's great to have some of that work already underway. We hope to do more of that, and we welcome opportunities to work with our colleagues and to collaborate on the inclusion of or updating of the current training programs into the future. One of the training programs that we currently have is for primary schools. So we know skin cancer is the most common cancer in Ireland, and children are particularly vulnerable to sort of sun exposure. So it's great to have these lesson plans for primary school teachers so they can incorporate some of those SunSmart messages and skin cancer awareness into their daily lessons. So the lessons are divided into two sections, from junior infants to second class and third class to sixth class. And we've been delivering these in various different ways through teacher meetings, through the trainings that are ongoing through the school year, and at our summer schools. So teachers have had these made available to them in hard copy. They're also available to download on Skullnet. And, it's great to get feedback from the teachers in terms of any edits or additions we might make to future versions of these lesson plans. So if you're working with schools, really great to encourage them to incorporate these into their SPHE lessons. There's a whole host of resources available for teachers and parents on healthpromotion.ie to order or to download on hse.ie/sunsmart. There's really good FAQ document. There's posters and booklets on the 5 S's to follow to reduce your risk of skin cancer. There is lots of information aimed at the children and parents, so as well as the art competition that's also held each year as part of the SunSmart campaign. So being SunSmart is also part, as we said, of the SPHE curriculum at post-primary schools, and again, it's great to have that incorporated into raising awareness around skin cancer for young people, again, particularly vulnerable to sun exposure. So if you are someone that works with schools or takes part in any of the schools training, it would be great to flag this as part of that training to really promote this area for schools. So this is Castle Island Community College, who I've been working with over the past year. And they here they are winning the overall prize for the Young Social Innovators this year for the work they did on becoming a Sun Smart school. So they became interested in working around the topic of skin cancer when they participated in the schools awareness program that the Marie Keating Foundation run. And they approached the NCCP to support the work that we're doing in the Young Social Innovators application. So the school have really done tremendous work in actually putting together a wide range of supports for the school. This is a workshop we held for the transition year students and their teacher. Through the work that we've done over the course of the year, they've put a number of steps in place that include developing a Sun Smart charter that all the whole school community signs up to. There's training available, there's supports and resources, and also they carried out a number of surveys among the whole school community so that they could raise knowledge and awareness and then start implementing some of these Sun Smart behaviours through the everyday school day, and then communicated that to parents as also. They also had the opportunity to work with the local primary schools in that community. So it's really been a real whole school approach to developing this Sun Smart school, and we hope that that will become a really good model, a case study for other schools to take on in terms of developing their work around being Sun Smart in their school. So a good place to start is to increase capacity for cancer prevention is the HSE Land e-learning programme called Reducing Cancer Risk. This is available for health and social care professionals on HSE Land, and it covers a number of different modules on various different risk reducing behaviours. You can see here there are 11 in total, and you have to complete 11 of the modules to get the CPD and the certificate of completion. So they are all about 10 to 15 minutes long, so it's very doable, and we would encourage you all to complete this training and also promote it with your colleagues as well.
Thank you, Chair. It makes sense that we try to incorporate cancer prevention and early diagnosis messages into existing programs that are already out there. Caroline Murray, Senior Health Promotion Officer for Cancer Prevention and Community Healthcare West, is now going to talk about health inequalities and prevention early diagnosis and touch on a project she was involved in recently.
Thanks to everyone for joining us today. Reducing health inequalities is a priority of the National Cancer Strategy and indeed the Healthy Ireland framework that we are all well aware of. Health inequalities are associated with poor symptom awareness, delayed presentation with symptoms, and low uptake of services, including screening. While the relationship between deprivation and cancer is multifaceted, certain cancers are more likely to be diagnosed in deprived groups. Much of this inequality relates to higher smoking rates in deprived populations, resulting in higher incidence of smoking-related cancers. The National Cancer Registry's report from 2016, Cancer Inequalities in Ireland by Deprivation, Urban, Rural, Status and Age, reports a statistically significant higher cancer incidence in the most deprived compared with the least deprived for 3 cancer types: lung at 60% higher, stomach at 40% higher, and cervical at 120% higher. In addition, people living in geographic areas with higher levels of deprivation are more likely to have higher cancer mortality rates once they are diagnosed, 40% more likely to die from their cancer within 5 years of diagnosis, according to the NCRI report above. Understanding the Challenges of Cancer Report 2022, seen here, looks at understanding the barriers to early diagnosis faced by vulnerable patients and the barriers affecting cancer recovery and survivorship, among other things. A link to both reports will be provided in the post-webinar email for further reference. Just to give some examples of projects that we have been involved in, this project that took place in my area involved training community health workers from the Traveller projects in Galway and Roscommon. I applied for funding under the Adult Literacy for Life funds to train the community health workers in relation to the 5 top cancers in terms of incidence, and to co-design resources and messaging in relation to these cancers. They then in turn piloted the resources and messaging in their outreach programs with Traveller families. I liaise with my colleague Anne-Marie in the Southeast and her work with Traveller health workers to develop and review resources also. We are now at the evaluation phase of this project, reviewing the content and appearance of the resources. Resources are A5 size back-to-back and include information on how to reduce your risk of the cancer and what are the signs and symptoms of the particular cancer in order to find cancer early. The 5 cancers include bowel, breast, skin, lung, and prostate. For those that have screening programs like the bowel and breast, information was given in relation to screening on the A5 leaflet also. I liaised with the National Screening Service in terms of this content. This is what the resources look like at the moment, and as I said earlier, they're being currently evaluated. This is another Traveller project that my colleague Anne-Marie was involved in, and it was through the Fishing Future programme in collaboration with the Traveller Mental Health Coordinator in Wicklow. It involved St. Cohn's National School in Rathnew pupils learning to fish in a safe environment where volunteer anglers provided the skills to fish to the students. As part of the programme, the children received wide-brimmed hats and sunscreen and were educated on being sun smart when outdoors through the use of sunscreen board and interactive quiz. The teachers in the school received the SunSmart lesson plans and SunSmart promotional materials to reinforce the messaging. The volunteer anglers seen here in the photo also availed of the sunscreen protection and education around being SunSmart. Just to flag some cancer-specific research with the Traveller community that is coming soon, and it's entitled Cancer Awareness and Attitudes Among the Traveller Community in Ireland, a co-designed study led by UCD in collaboration with Pavey Point Traveller and Roma Centre and the HC National Cancer Control Programme. The Traveller community health workers and Pavey Point were largely involved in the co-design and data collection for this research in conjunction with UCD researchers. At the Irish Cancer Prevention Network Symposium, the lead researcher, Dr. Patricia Fox from UCD, presented top-line results, including that 1/3 of travellers would not want to know if they had cancer, and older people over 65 were more likely to have negative views in relation to cancer. 60% of the respondents would discuss symptoms with their GP, but 40% identified talking to the receptionist about their symptoms as a barrier to presenting to the GP. A link to this talk will be provided in the post-webinar email, where other top-line results can be viewed with the full research report to be published early next year. Because lung cancer is one of the cancers reporting a higher incidence in the most deprived populations, one of the actions we have undertaken is to talk to our Stop Smoking advisors and our We Can Quit facilitators about lung cancer each year in November, as it is Lung Cancer Awareness Month. Our presentations aim to highlight signs and symptoms of lung cancer and the important role Stop Smoking advisors have in raising the subject of getting any new symptoms and changes to existing symptoms checked out by their GP. Example, a new cough lasting more than 3 weeks, as per Lisa's campaign in North Dublin, a change to an existing cough, breathlessness more than is normal, etc. We also talk about what the next steps may be for a client if they are referred for a chest x-ray or to the rapid access lung clinics by their GP. The hope is that this may reassure the client about the steps involved and help them present earlier with symptoms to their GP. Just to flag also a programme that Ireland are involved in across Europe in an EU for Health funded pilot in relation to lung cancer screening. The pilot is called a lung health check as opposed to lung cancer screening, with the hope that this will improve the uptake as a result. It is referred to as the SOLACE programme. The pilot in Ireland will focus on deprived areas with an age cohort of 55 to 74 years. There is a particular focus on groups that are at a higher risk due to health inequalities. The study will use low-dose CT scans and spirometry to screen people. A link to a presentation from Professor Patrick Redmond seen here with more information on this proposed lung health check pilot will be in the post-webinar email. I hope this has given you some idea of the work we're currently involved in relation to health inequalities in cancer. This important topic will continue to be a focus of our future work as cancer prevention, health promotion and improvement officers. Thank you for your time today.
Thank you, Caroline. It's great to hear about the collaborative work addressing health inequalities happening around the country. We're now going to hear from Shirley O'Shea, but this time around she will talk about ways we have incorporated cancer prevention into staff health and wellbeing through the SunSmart campaign. Over to you, Shirley.
In terms of staff health and wellbeing, this provides us with another opportunity to work with our colleagues on cancer prevention and incorporate some of those SunSmart messages over the SunSmart campaign. We've used a variety of ways to do this, including the distribution of these sunscreen dispenser boards throughout some of the HSE work sites. We've also ran some HSE staff competitions, and really just to try and encourage finding out more about the SunSmart messaging and the campaign around the time when the UV index is higher from April to September. Also incorporating the logo and the SunSmart messaging into the SunSmart Walking Challenge, so that it's really sort of made aware that, you know, as part of being outdoors more and taking part in physical activity, to be aware of the risk of the UV index being higher and to protect yourself from the sun. So here are a number of the maintenance workers that receive the SunSmart dispenser boards. Outdoor workers in particular are at a higher risk for skin cancer. So a session was facilitated with these in particular in relation to skin cancer prevention and early diagnosis. So that was done on site. And also encouraging those that do active commuting, you know, to be aware about using the sunscreen as well. We've also made it available in other hospital sites like maternity units, older care, day units, and making it available in some of the acute hospitals for staff, patients and visitors to use also. Finally, I just want to promote the Cancer Survivorship Peer Support Service. This is for HSE staff and HSE funded agency staff in 6 pilot areas across the country. And the service is designed to offer a compassionate one-to-one support from trained peer supporters. So it's really for HSE staff members who are either newly diagnosed with a cancer diagnosis or undergoing treatment, or perhaps have returned to work. So it really just offers a compassionate listening and a service and an opportunity to just share experiences and provide support, and also really just to signpost to relevant resources as needed. So there is this poster and flyer that you can see here, and also a really good video that gives you lots more information here. It's a great collaboration between Health and Wellbeing and the Mary Keating Foundation and the National Cancer Control Programme and National HR. So we really would ask you to spread the word about this great support service for staff. Thanks very much for listening.
Thank you, Shirley, for a lovely overview of the work to date linking cancer prevention and staff health and wellbeing. Bernie Mullins is back with us now, and she's going to talk about our work to date in terms of stakeholder engagement and communication. So over to Bernie.
So I'm going to give a very brief insight into some of our work in stakeholder engagement and communications. So the aim of this is to coordinate and increase the reach and engagement of the National Cancer Control Programme information and resources by working in conjunction with a wide range of regional stakeholders, both internal and external to the HSE. We work in partnership with regional HSE communication departments and other key organisations, and we seek to amplify this national messaging at local level and adapt where there is an identified need regionally, such as the Traveller Health Project that Caroline and Anne-Marie referenced earlier. Our role employs multiple communication engagement methods, including but not limited to digital social communications, print and online media, radio, and regionally informed and targeted stakeholder engagement. So just to say some of our key objectives, like we want to raise broad awareness of cancer prevention, early diagnosis messaging among the general public, while also targeting specific groups. Like for example, generally in the public, awareness that overweight and obesity and alcohol use increase the risk of cancer. That would be low. We know that people have a high insight that tobacco causes cancer. So we have a lot of work to do in that area. We want to develop a spokespeople for the amplification of key messaging around cancer prevention, early diagnosis. And we will continue to engage with existing health and wellbeing programs. We want to optimize cancer prevention and early diagnosis opportunities, which is really why we're here today, about integrating cancer prevention into established health promotion programs. Engage with healthcare professionals to support and inform their work with that cancer prevention and early diagnosis lens. And we'll collaborate with key stakeholders such as local government to inform a systems approach to effective cancer prevention strategies and activities. And we want to deliver multi-channel communication activities regionally and an annual local communications plan that aligns to NCCP communication priority campaigns to promote the programme among internal and external stakeholders. So we're doing all this along a background of, just to say that nearly 30% in Ireland of people in Ireland have limited health literacy that can be problematic and inadequate. So people self-report difficulties in accessing, understanding, appraising and applying information in tasks concerning decision making in healthcare, disease prevention and health promotion. So this, we need to keep this in the background of everything we do. And just to say, from the national strategic context, those three documents we referenced earlier, communication is huge in these, stakeholder awareness, huge public awareness campaigns. This is part of our work. We want people to recognise and act on the symptoms. So these are leading and informing our work also. And just to say as well, some key kind of calendar dates, we work all year round on cancer prevention generally and the 5 main cancers, but there are key months where other partner organisations be doing work as well, and we try to really increase and cement the messages, and you're hoping that the public will, get it from multiple angles. It really hits home in terms of cancer prevention and early diagnosis, such as the Irish Cancer Prevention Network. So in terms of stakeholder engagement, again, this is both the tip of the iceberg. We've engaged with multiple stakeholders, internal and external to the HSE. There's been some commonalities across our areas, but there's also been very diverse stakeholders and differences in each area as well, which has been very interesting. We're trying to bring a very different lens. If you look here, even Men's Health Week and collaborating in that area, when people think of men's health, they often think testicular cancer. Well, actually, testicular cancer, there's about 169 cases a year in Ireland, whereas actually, if you think of lung, there's 1,386. So sometimes it's just bringing that lens and that perspective to someone's work. If you look at age friendly, for example, which is, it was supporting older people, we're really, looking at how can we optimize the early diagnosis piece here. So look, we've had a very diverse engagement over the past year, and looking forward to this continuing in 2025. Just to give an example of partnership working, we've all worked with county councils locally, really important stakeholder, and a key target action area is outdoor workers in the National Skin Cancer Prevention Plan, hugely at risk of skin cancer. So we worked significantly with lifeguards, outdoor workers such as traffic management, water treatment, all those kind of people who are out in the sun as part of their occupation. So we worked with the county councils in very diverse ways, but really successful, and hoping that the councils now will adopt some of the pieces we've brought in and continue that work and continue that collaboration. In terms of general communication, so we're really trying to extend this reach beyond the walls, the health service, out into communities. So as I said, referenced earlier, multi-channel media, we're at large events to meet people, such as age expos, where you can have the opportunity to engage with hundreds of older people. We have podcasts from the national team that we try to extend locally. We work with healthy clubs, disability organisations. A lot of radio interviews have taken place at regional level this year, so it's been really good, such as in Midwest Radio 96.1 FM. Caroline, who you heard from earlier, would have done a very successful mini podcast series, so little snips of information we're trying to get out into the community, and that's been so successful. It's going to be extended for a second season. So we want to really utilise all these mediums out in the community. Another example, we have a lot of print media that's gone out regionally, and I collaborated with Clare County Council, their Healthy Clare coordinator, to get some, full page and half page ads into their local newspaper, an existing Healthy Clare page, and like that has gone really well. A huge viewer circulation figures in County Clare about sun smart, men's health cancers, sunbed use, breast screening, lung, and subsequent pieces planned for prostate cancer, reduce your risk of cancer as well. So there's a lot of collaboration going on. And just to say as well, there's a lot of very excellent national pieces the national team develops, such as these webinars, and we always, we try to amplify these regionally as well. So I'm going to finish on that slide. Again, a really whistle-stop tour just to give a brief insight into the amount of stakeholder engagement and communications, but in a topic like this, where we're trying to get the message out that there are things we can all do to reduce our risk of cancer, and we need early diagnostic cancer, stakeholder engagement and communications is absolutely core to our work. So thank you.
Thank you, Bernie. As you can see, there's been plenty of work done around stakeholder engagement and communications, and we will continue to do this on an ongoing basis. So that comes to the end of our presentations for today. So I'll open up the floor to questions and answers now. And the other senior health promotion officers are going to join me. So we have a couple of questions coming in there. So the first question I have is around bowel screening. Why is it not offered from age 50? If one of the ladies want to take that question.
I can jump in on that, Lisa. Just I referenced it in my introduction.
Thanks, Bernie.
So this is a really common question when we're engaging with groups. It does actually come up quite a bit, so I'm glad someone has asked it today, actually. Just to say, I don't work directly for the National Screening Service, but we will collaborate with them and support their work, because there are 3 cancer screening programs. They obviously support early detection and early treatment of cancer, but then even cervical and breast also have that piece where they can reduce the incidence of a cancer by treating the precursors to cancer, such as, in this case, they've mentioned bowel polyps and bowel cancer. So I suppose the decision around any screening program to start, stop, or in this case, the person has asked about the expansion. It's a multifaceted decision. They'll weigh up, important aspects like resource use, benefits of a screening program, but also harms, because we do know that every screening program, there can be overdiagnosis, overtreatment, false negatives, false positives, and again, psychological worries too. So there's a really delicate balance of that that has to be weighed up by the National Screening Service to come to their decisions. So up till October of 2023, bowel screening would have been for people aged 60 to 69. Now, in a very welcome move, it's been brought back to people aged 59 since October last year. I suppose ultimately speaking, HICWA have recommended that it be brought back to age 55 and extended up to 74. Now, the National Screening Service in Ireland are working towards that, but again, it will be a gradual, planned, managed expansion, because you have to ensure that everyone has access to, onward testing and treatment if needed. For every 1,000 people who participate in bowel screen, 33 of those will subsequently be invited to participate in a colonoscopy. So again, there is kind of an onward effect to this. So I suppose that's just part of the decision making, one of many kind of multifaceted pieces in it. Just to say that, again, I referenced this briefly, we have less than 50% people in the eligible current categories participating in bowel screens. So that's huge. We'd love to see an uptake of that. So again, the test is really simple. Participating, I know there's a lot of healthcare professionals on here today. Whatever we can do to promote uptake about bowel screen in the current categories. But look, at the news is positive. They will be looking to onward expand it in the future. Hope that answers that person's question. And if they have any other questions about the reasons, kind of the age categories, any of the bowel screening, our contact details will be shared afterwards, and happy to have an extended chat. I don't think the time allows for it today, but hope that answers their question.
Thanks, Bernie. For the next question, I'll just read it out here. Are cancer rates diagnosis rising significantly in Ireland? Does someone want to take that?
I'll take that, Lisa.
Thanks,
Look, the number of people developing cancer has increased as Ireland's population has grown. Like in general, cancer occurs more often in older people, and the proportion of older people, those over 65, has increased over the last few decades. But it's not a simple black and white answer. So rather than just looking at numbers of cancer cases or deaths over time, the National Cancer Register of Ireland follow trends and look at rates, incidence and mortality per 100,000 population, and they have to adjust for population increases and for age and different influences. Cancer is not just one illness, it's a group of illnesses. So it's not an easy one to say, yes, cancer is increasing. Like certain cancers, while the incidence rates are increasing, maybe there's other, like their mortality rates can be stabilizing and actually decreasing. And that can be influenced by screening services, new treatments, and earlier diagnosis work. Other cancers, there's increases in mortality rates as seen for a small number of cases, and that's broadly in line with trends that the National Cancer Registry follow. So to answer it in general terms, overall, yes, cancer rates are increasing in line with an aging population and an increased population. So, but it is important to look at it in a much more nuanced way. And that information is available if you want to look up the NCRI annual reports online, and it gives you much more detail and brings it much more into, incidence versus mortality instead of a black and white yes or no.
Thanks, Emery. So our next question is around alcohol. So the person wants to know what alcohol-related cancers and prevention are available at the moment.
I can take that
Somebody
one,
want to
Lisa.
take that
Hi,
one?
everyone.
Thanks, Caroline.
In terms of alcohol, there was a very good presentation by Cliona Ní Bhucala at the ICPN conference recently, and I'll root out that link now shortly, and I'll send that on. But that's worth watching back in terms of, it just highlights that a lot of people are not aware that alcohol is a risk factor for cancer. They could name sun straight off and tobacco, but often alcohol isn't one that's, in the forefront of their minds. And I suppose it is one of the most preventable risk factors after smoking in terms of reducing your risk of cancer. So it is one that we'd be very interested in working more with even the alcohol leads in each of the areas going forward, and trying to get that message out. There's no safe limit of alcohol consumption when it comes to cancer risk. And drinking alcohol increases your risk of at least 7 different types of cancers. And I suppose what was interesting from that presentation as well is just it highlighted the combination of drinking alcohol and smoking, which a lot of people do, and how that multiplies your risk even further. So you're at at least a 5-fold increase if you do both, and that can go up to even 30 times if you're a heavy drinker and smoker. So that's interesting kind of research, and I suppose it's something that we can bring to even our stop smoking advisors as well, in terms of that you're often, as a stop smoking advisor, you're chatting about how they always smoke when they're out drinking, or so there's all that big link there. In terms of resources, I suppose I'll send on that link for that conference piece. There's also HSE land modules there's a module on alcohol so all the risk factors, we've modules on them on HSE land and the preventable risk factors. So there is one on alcohol which is about 10 minutes long, which is worth doing as well, just in terms of the background. And then on healthpromotion.ie we have resources in terms of there's a 1-pager on alcohol and cancer reduce your risk, so you can download that from there. And there's also a number of different posters. So there's kind of a general poster, and then there's a male and a female version as well. And that just shows the different, for the male cancers that are linked with alcohol, and for the female cancers. So yeah, so as I was saying, this is an area that we hope to do more on. And we would be interested in linking with our cancer leads in each of the areas in relation to this. And I'll send on those links now shortly.
Thanks, Caroline. Another question in here. Question is, are there any plans to embed cancer prevention messages across other health promotion teams, such as physical activity, the dietitians, etc.? Would somebody want to take that question?
Yeah, I can take that, Lisa. So
Thanks, Shirley.
So when you think about it now, that what we've heard today is the culmination of about a year's or more work since we've all been in post. So it's still really early days in terms of looking at opportunities that where we can collaborate with our health promotion colleagues. And I think that there's many opportunities to do that. I suppose we've started having those conversations, but there's more to be done there. I think obviously there's a big focus on chronic disease, which dictates a lot of the work that's already been established in terms of training and all the different priority programs. And we just like to look at cancer prevention and early diagnosis as an opportunity to update or integrate some of what we've been talking about today into what already exists. So rather than looking at it as a new area, a new piece of work, that we're in post now just over a year, and it's a really great opportunity for us to start looking at some of those existing programs and where we can work more closely with our health promotion colleagues.
Thanks, Shirley. I think we'll just take one more question because I know it's getting close to lunchtime, and then we'll wrap up with some signposting. So the next question is a update on lung cancer screening in Ireland. And I think because this is relevant to me in my area, I might just answer that one. And I know that Caroline already mentioned this in her presentation earlier, but there is a lung cancer health check pilot due to commence soon in North Dublin and the North East. The pilot will have a focus on early detection and target high-risk individuals such as current or former smokers. The initiative is a partnership between the Beaumont RCSI Cancer Centre and the Irish Cancer Society, and people will be invited to attend community-based mobile scanning units for lung health checks. We don't know the exact date of when that pilot is going to commence, but it is planning to come soon. So I think we'll wrap it up there, and I'm just going to share final slides with you, if you just bear with me for 1 second. I hope everybody can see them there now.
That's perfect, Lisa. Thank you.
Thank you. So just before we close up, as I said, I'm going to draw your attention to ways that you can extend your learning. So first of all, I don't know if you've heard of the Irish Cancer Prevention Network. They publish a quarterly newsletter and they share cancer prevention facts and initiatives via an e-zine. So we're going to send you out the link to that of how you can register or sign up. And it's really worthwhile because they send lots of useful information. And the next thing I'm going to draw your attention to is our HSC Land e-learning modules on cancer risk reduction. So the program allows you to learn around, sorry, 1 second, my slides are doing funny things here. So on HSC Land, you'll find the Reducing Cancer Risk e-learning program. The program will allow you to learn how behaviour change can help reduce the risk of cancer. So it consists of 11 short modules, each taking approximately 10 to 15 minutes to complete. And I know Shirley discussed them earlier as well. Then there is also an e-learning program on early diagnosis of cancer. It consists of 2 30-minute modules, and you learn how to recognise the signs and symptoms of cancer and appropriate action to take. Our colleagues from the NCCP, Trina, Breda and Heather, have also recently discussed cancer topics on the See Talking Health and Wellbeing podcast series, and it's definitely worth a listen. And you can also find various resources such as leaflets, posters, etc. on healthpromotion.ie, and you can order copies of these for free. And some online resources are 3 websites there, which is the NCCP Cancer Prevention, NCCP Skin Cancer Prevention or SunSmart, and the NCCP Early Diagnosis website as well. And the links to these will also be shared at presentation. So thanks everybody for listening today, and please don't hesitate to get in touch with us with any of the senior health promotion officers in your area if you wanted further information, and all our contact details will be shared after the webinar today in a pre-webinar email. So thank you very much. So I think we'll just end it there now, and thanks everybody for listening.